Next speaker is Wexiang Wang. Dr. Wang is he's professor. He was earned a bachelor degree, master degree, and a doctorate degree in Nanjing University of TCM. He also was invited to many different countries to the visiting lecture. Today we are welcome to Dr. Wang.
Good afternoon, dear colleagues. I think I'm going to make up the time, so we will finish on time to make sure we can start the dinner on time, indeed. So, my presentation is about the general situation of TCM education in Europe and cooperation opportunities. So, mostly indicate the cooperation opportunities with the outside of European countries. In this case, mostly, I think, with China. So about myself, Professor Shen already introduced. I thought I have enough time to introduce myself, but since the time is too tight, so I just skip this one. And as Professor Sun Piding in the morning, when we have the legislation forum, he confirmed, and also he emphasized a few times on the TCM education. So I do believe the education of TCM brings a different quality. Let's look at the situation of TCM practitioners in Europe. There are different categories. So category number one, I just put in different category, it does not make a difference which one is better. So China trained doctors, so they're trained in the universities mostly in China, and they got the medical doctor titles there, and now practice in Europe. And we have European medical doctors and physiotherapists with Chinese medicine with training, mostly with a short course, and some countries that do have a long-term training course. And category number three is a full-time education, mostly like, as I know in UK, there were quite a few universities, like 7 to 9 universities, but unfortunately it's getting a little bit diminishing due to different reasons. And also in Portugal, there are a university who offer the 5 years full-time educations. So that's very exceptional in Europe. And most of the TCM practitioners in the Western country, as you probably know, that they are part-time training or weekend training. So 1 weekend in a month, that indicates 10 weekends in a year, and can last 3 years for TCM and another 2 years weekends for Western medicine. At least that's the situation in the Netherlands. So the training of TCM in Europe is a more vocational training, so people come from different backgrounds, and they have joined the weekend courses, and most of them own their career and families with children, with parents, etc. So you can see like a very young guy sitting together with, in Holland we call the Opa and Oma, grandparents. They're sitting together in one group. So personally, I think the development of the education of Chinese medicine in Europe, they have a lot of opportunities, but also meet with challenges. For example, the quality of the lectures. So most of the lectures are originally produced, like Charlie, for example, has a lot of experiences. They explained Chinese medicine in European way. I've been following with different seminars by the Western people. I think they do have their advantage, you know. They explain the East philosophy in a Western way, which also gave us a lot of tips. Because when Chinese teachers giving education to the Western students, they use purely Chinese philosophy. Sometimes we think, as a Chinese lecturer, we think, of course, why you ask why? But for the Western students, they don't understand that because they come from totally backgrounds. So I do think for Chinese lecturers, we can learn from Western lecturers from how to explain the Chinese theories to the Western peoples. And also we need to make a standardize of the core curriculum, because you see they're pretty much different, quite diverse from one school to another one. So some schools offer like 100 hours education, another school 300 hours. So basically that's because of the core curriculum. They are so different. That brings a different qualifications of their students. And also the TCM textbooks. So personally, I think in UK or in the other European countries, if you educate TCM in English, most of the schools use a book from Manchester, for example, who is also our colleagues, also studied in Nanjing University of Chinese Medicine before quite some times, or use the books from both flow. No matter it's from which of them, but we have to realize all of these books, they are not real and written for the daily education, for TCM education. So as long as you use these books, you do find there are some difficulties to explain to the students step by step. So I think in Europe or in the outside China, I think, so we very urgently we need this kind of book who can offer the real TCM knowledge and experiences with tailored textbooks. And also we need to have a well-organized TCM training system, in the clinic training system. I think in United Kingdom they are a bit advanced, as I know, like from Dr. Shen in the Lincoln universities, or from Tianjin in the Western London University, they do have education clinic. So students got some chance or more opportunities to use their hands. But for the rest of the European countries, mostly the students, they are not allowed to use their hands, but their eyes only. So they can watch. So if you ask, when I work in the Netherlands, my students also follow me, they ask my patients, can I follow with Dr. Wang? They said, okay, as long as you watch, it's okay. Don't touch me. But do you believe the students can get enough practical experience by only watching? I doubt it. And we mentioned in the morning also with the CPD part, so they are, I'm not really trying to criticize any of the organizations, but I think CPD, or as a mandatory CPD, is very important even in China. As a medical doctors, you need to have do the CPD every year, which keeps you updated with the development of Chinese medicine, but not only Chinese medicine, also the Western medicine. For example, there are two speakers talk about the toxicants of Chinese herbs, But traditionally, we don't have the full information about certain herbs. But we have to realize that certain herbs brings a lot of poisoning to our body, especially to the kidneys and to the livers, which is pretty fatal. So I think we need to have this kind of information, not because we are practicing Chinese medicine, we try to make these medicines perfect. And I think in the Western countries also we say that nothing is perfect, no one is perfect. Only things, if you want to be perfect, you go upstairs in the sky, in the heaven. So sometimes we are overprotected Chinese medicine. We try to ignore the side effect, which is, I think, should be more realistic. And also we should upgrade the education from the postgraduate. So only the weekend education is not enough. We have to train more students with postgraduates. And some ideas, for example, we have a mutual acceptance of TCM, of diploma and practice qualification in Europe. That would be very encouraging to bring some experienced Chinese doctors to Europe, which can help to improve the quality of practice in the Western countries, and also the TCM clinic education, because as disease, as the time goes, the disease is also they're getting quite a broad spectrum. So many diseases, not only for Chinese medicine, even for Western medicine, not only for Western medicine, even for Chinese medicine, we never experienced this kind of diseases. So it's a new challenge, for example, SARS, or for example, swine flu. So we never heard of that. We try to use a traditional theory to explain that, but probably theoretically explanations still have certain limits. And the education for experimental and clinical scientific research, I think this in the European countries, this is a shortage. So we need to show the Westerners, whoever is practice medicines or just a normal people, to show them some evidence. I know many of my colleagues, especially if you're trained in China, we are pretty against evidence-based medicine. We say, no, Chinese medicine which can treat these patients, they feel good. That's it, that's evidence. Probably in 22 centuries, this is not enough. That's my personal idea. And also we have opportunity to cooperate with Chinese universities to establish the TCM database. I think we have many professors and lecturers here who teach in the Western countries. You find we need to ask our students to write a thesis, which is very difficult for them to write 10 pages even. Why? Because they don't have enough source of the information. Of course, if you can read Chinese, no problem. They have thousands of the articles if you just go to Vanfan data, But in the Western countries, in English, no. You don't have this kind of information. I think this is a very, very necessary and very, very beneficial for Chinese medicine. Who, for the practicing Congress mentions, this is one of the way to bring all of the TCM practitioners. Does not matter you graduate from Nanjing, from Shanghai, Beijing, Anhui universities. I think we study the same universities. By these opportunities, we have a platform to experience our experiences. And also our challenge also comes from the effective and the safety of the TCM products. As I just mentioned, so TCM, even acupuncture, is not 100% safe. Yeah? So I think probably a few decades ago, when we tried to promote TCM or acupuncture to the Western countries, we just said, okay, acupuncture is safe, no side effect, or TCM herbs is safe, no side effect, but that's not the truth. And I want to take 1 minute to give you the information about ETCM. So this is a European Academy of Association of the TCM in Europe. So this is a member countries in Europe, which you can find some association in Europe countries. And we have 14,000 members in the associations. So this is, you can find the practitioners per country. And all of this information you can find from our websites. We just explained to you. So if you have more information about my presentations, for sure we have a time to exchange in the evening or tomorrow. Again, due to the time, so I cannot go further. And I think in the morning, and Professor Zhang asked me, one of the questions is, how do you see the future of the TCM in Europe? I made a little bit longer, probably it's not so clear, the answer was not so clear. But I think the clearer way to give my answer is this picture. So we said the future, you can see the blue sky on top, but still you can see clouds. Thank you very much.